Did you ever feel like you were leaving behind your identity? Like when the doctor name is attached, if we do anything else, everybody will question us. So why are you leaving such a prestigious degree?
Sticking on meant I had to fight, which meant the fight was mine. I had to learn it all from scratch and I had to learn it by myself.
Like you're not just teaching English, you're changing someone's life.
For me, success is contentment. It's being content with what you're doing.
What mindset shift is most important for preparing for any kind of exam?
So don't think that another person's happiness is the same for you. They might be happy with something else.
Welcome to the new episode of The Dental Lens. Today we are joined by Dr. Mary. From stepping away from dentistry to becoming the bridge between healthcare professions and their global teams, Dr. Mary has an immense career shift, starting as a dentist and now she is an international trainer for OET and IELTS, which helps dentists to settle in other countries. Please welcome Dr. Mary. I'm so glad to have you on today.
Thank you so much.
Dr. Mary, you have began your journey as a dentist, a path many people spend years trying to achieve. But today you are helping other healthcare professionals build careers across the world. Where did this shift begin? Where did you realize that this profession is more than just being a clinician?
Thank you, Dr. Saida, for inviting me to your show. Actually, this shift sort of began once I decided, okay, I needed to do something beyond dentistry because I thought I was good at teaching. So, and English was my passion. So I just shifted it when I thought I wanted to teach English. And I started off with IELTS, which is the International English Language Testing System. And yes, initially I had a lot of nurses and medical professionals doing the IELTS also. So I started it off from then. And then we had students who joined for PT, Pearson Test of English. Again, an exam that professionals or anyone had to take if they had to go abroad. So, yes, I was quite happy with what I was doing. 10 to 12 years down the lane, I slowly got to know about OET, Occupational English Test, and I thought, why not try my hand at it? It seemed a little bit difficult initially, as always, acceptance to anything new is difficult. So I sort of started with OET then. Initially, when I started, I had no idea of what it was. I was totally clueless on how to go about it because, unlike IELTS or PT, this was completely medical. And being from the medical field, it was like I was supposed to know everything, how to do it and how to go about it. But it's language with medical. So it meant that it was not just knowing medical, it was also knowing how to go about OET, because in OET you have a lot of strategies and criteria that you must know, and so I had to start from scratch. And by then, I think I was pretty good at IELTS and PT. So starting OET from scratch was again a challenge for me. So this is where I took the shift and I started on with OET.
You have upgraded yourself with every career move that you are making. But walking away from dentistry must not have been easy for you, especially at that time. So, what did that phase really feel like for you?
In that phase, like you said, it was not at all easy because, it took a lot of convincing. I had to convince my family that, I wanted to move away from dentistry. I wanted to do something that was entirely different. So that took quite some time. I convinced them, and they said, okay, well, if that's what you want to do, go ahead with it. And yes, I then stepped on into OET, and not only OET. When I started with IELTS itself, I knew that my degree being one in dentistry, I needed to do something beyond that. Only then I would be accepted into that field. So a year after I, started with IELTS, I did a post graduation in literature. So that was a very different field into which I was going, and doing a post graduation in something that you've not done a graduation was very difficult. And I remember the first year was like I thought I had made a big mistake. But I was doing what do you say, a course from IGNO. So the Indira Gandhi National Open University. So since it was an open university, I had my time. I could, go through the books. It was difficult, but I don't know. God's been with me, I guess, and my family's been a big support because I was able to complete it in 3 years. And yes, that was a big turning point, I should say.
And leaving behind your field where you have practiced for years and then going into completely different one actually takes much courage and strength. We have that stigma attached that when you have done something in healthcare like dentistry or a doctor, that people doesn't make us leave that behind. So did you ever feel like you were leaving behind your identity, like when the doctor name is attached, if we do anything else, everybody will question us, like why are you leaving such a prestigious degree?
Yes, yes,
So
yes.
did you ever feel like you were leaving behind your identity?
Several times. In fact, the first, I don't know, maybe 10, 15 interviews that I went to, people kept asking, so haven't you completed your dentistry, or is it something, why are you leaving midway? Where's your certificate? I was asked, I said, see, I have done my dentistry, I have completed it, I was working, but I wish to change the field. So, like I said, this is the one of the reasons that I had to do a post graduation in literature, because then I could, portray myself as a person who's done literature. And so that actually helped me a lot, that literature and the medical background at this stage. Because now when I do OET and when I'm teaching students, uh, some of the parents do ask, well, are you qualified to teach nurses, or are you qualified to teach a doctor? So I say, I'm a doctor myself. So that's one thing. And then they ask me, okay, then what about your language? I said, well, I have a postgrads in literature. So they're like, okay, they don't have any more questions to ask. So I think I've done
I think
complete justice there.
it is a complete culmination of both of your degrees, teaching OET to healthcare
Yeah,
professionals. You
yeah,
come from the background, you have the education of MA literature, it is not easy to do. So I think it completes your arc of getting here.
yeah, it does.
What gave you the strength to keep going when the outcome was not certain? Like when you faced difficulties, what was it that?
Yeah, initially it was really difficult because the as I said, the acceptance was very bad, because there were a lot of professionals in the field who had done purely literature, and they had come there, and they were obviously they were questioning what was I doing there. So sticking on meant I had to fight, which meant the fight was mine. I had to learn it all from scratch, and I had to learn it by myself. So I would say there were days when I would, if it was IELTS, we had graphs. So I had to, I used to take home around 5 to 10 graphs home, and I used to sit and, write it down. This was much before internet was so popular, and we had help from internet. Now you just type down, or you give the picture, you get a whole thing written on ChatGPT, or you can get it all done. But this was much before that, and I had students who were really good. So if they asked a question, I had to answer. So I had to go do a lot of homework. That helped me actually, and that helped me to stick on, and that gave everyone who asked me a question, "What are you doing here?" an answer.
I think finding your place in a new field is a bit difficult. Now it is popular that you are branching out of dentistry. Many people are branching out of dentistry.
Yeah.
But back then it was much more difficult to branch out.
Yes.
Like English was always your passion, yeah.
Yeah.
But how did you teaching come into your life?
I think it was quite accidental, that one of my friends, she asked me whether I could run her play school for a couple of months. Her mom wasn't keeping well, and she said, "Can you just manage it for me?" So I said, "Yeah, why not? I could help you." And then I started off teaching the tiny tots. In the sense, they were like children who were like around from 6 months to children who were 4 years old. So I was basically, looking after them, or I had a lot of people to help around, but then, I was in charge of everything. And then a boy who was sick, yeah, 6 years old, he just walked in because he had come for a vacation from Australia. So he walked in, and his parents told me that they wanted him to learn some basics of the language because he wasn't good at it. So I started off, and I don't know, one after the other, and I think that's how I'm here today.
So you teach somewhere or you have your own institute?
No, actually, I have been teaching at different places. Been teaching with a lot of organizations. Started off with one, and then went on to the others, and yeah, taught with a lot of organizations in Kerala.
So what did you find in teaching that you did not find in dentistry?
I would say I found a lot of students come back with huge gratitude, because it had always been a dream of certain students to go abroad, and the only barrier that was there was this language test. They said, "Ma'am, I think we can, go through everything. Everything looked so easy. Applying for a visa looked easy. Everything looked easy. Choosing a university, everything. But when it came to a language test, they said it seemed nearly impossible to them. And once they had got it, they were really happy. And the best thing is seeing them after 2 years, they come back to see me. I don't know. It's those moments that make it all worthwhile. I think when they come back to see me and express their gratitude, they just don't have the words to say. They say our whole family depended on us, and now we are here. It's all because of you, ma'am. Well, I've just been a medium through which they could go, but I feel really happy that I could do that.
You are helping others achieve their dream. Actually, it has much more satisfaction level than what we have doing something for ourselves than
Yeah,
doing something for others.
exactly.
So, do you think passion is something we discover or something we build?
When you need to have a passion, only then you can build on it. Because unless you have that passion, that fire inside you, I don't think it could be put in by someone. So you have the passion, and then you build on it. Your dedication towards that passion helps you to go forward.
I think just having passion is not enough. You have to, as you said, that you struggled a lot in the starting, but you stick with
Yeah,
it. So
yeah,
I think sticking with it and making it a goal to achieve something in that passion, that
yes,
takes some another level of expertise or you know, say
exactly.
grit to do that. Do you think OET is just a testing your language, or how is it? Like, if someone doesn't know what is OET, can you elaborate? Like, how does it help the healthcare professionals?
Yeah, OET, it's basically Occupational English Test. It's for medical professionals from almost 14 different fields. Well, OET, as like IELTS, has four modules: the listening, reading, writing, and speaking. All four modules are basically all has medical literature. So, be it listening, reading, writing, or speaking, you have to be someone who understands the medical terms. So when you get into it, you realize that it's not just what you learned, whether it was nursing or dentistry or your MBBS, whatever. It's not just what you learned; it's much beyond it. So you have to have a vast knowledge. It builds. It builds with time, because I have seen students come in with sometimes very less knowledge of what they studied. Sometimes it might not be as much as what is expected of OET, but then you build over time, because consistent practice, dedication, your efforts pay off.
How much time does it take for a person to prepare for OET?
I could say it takes something between 1 to 6 months. It depends upon how good your language is and how good your understanding is, and above all, how much you're willing to put an effort into. Because there are certain students who come in who say, "Ma'am, I can't sit here more than 1 month. I can't do it." So you have to be a go-getter. You have to be perseverant, because the first month the first 2 weeks are going to be really difficult in learning the basics, how to understand each of these modules. And sometimes these students, they just give up on the 2 weeks. But there are students who stick on, and they say, "Ma'am, we are going to make it through. We want to finally write our exam and clear it and go abroad. That's our goal."
Why do you think so many talented doctors and nurses struggle with it despite being having strong clinical knowledge?
Yeah, like I just mentioned, it's not just about the knowledge, it's how you can express yourself. So, confidence plays a major role. You have to be confident enough. For example, a role play. In speaking, you have role play. So, when you sit for a role play, um, sometimes a role play can be very difficult in the sense that you might not understand everything that's given in your card. So, you have just your card. So the student who comes has to be the nurse, and the person who sits opposite is the interlocutor or the the patient. So when the nurse addresses the patient's concerns, the patient might not be sometimes very cooperative, or he might not be a person who is in his a mild temper. He might be angry. So you will have to handle the patient. You have to be confident to understand what the patient is undergoing and accordingly talk. Similarly, with writing, you have to be able to write a letter. So this is a letter that you are probably writing to a medical practitioner, or sometimes you're writing to another nurse. If it's a nurse, you're writing to another nurse. So you have to be good at explaining what is given in your letter in a clear and concise form. So that is sometimes it becomes a little bit difficult.
Mm. I think more than clinical knowledge, it kind of questions your confidence and communication
Yes,
skills, like
exactly,
it is
exactly.
testing those.
Yeah.
So, what are the biggest mistakes candidates make in OET?
Well, each module has certain set of mistakes that students make. For example, in listening, students have this thing of not understanding the different accents, so they don't practice different accents. Then the basics mistake that they make is not knowing spellings, especially spellings of simple words. I have had students not knowing spellings of thyroid, for example. They come in and then they're fumbling there. They don't know how to write. And the listening, for the listening, the best part is your part A. You have to finish your set of questions in a limited time. So you have 20 questions and you have 15 minutes, and the dialogues just go, just, sometimes you don't even hear words. So you have to be really fast. You have to be fast. You have to be able to write those words quickly. So at that moment, you can't sit and think about the spelling. You have to be super fast to finish off those spellings. So this is one thing. So in reading, students don't read enough, and uh, most of the students that I have who have come for whether it's IELTS or PT or OET, all of them say the same thing. Ma'am, we have never read in our lives. So I ask them, can you tell me something you have read? They start off with textbooks they have read. So I said, not textbooks. I want to know what else you have read. No, ma'am, we don't read.
Mm.
So, the first thing that I ask every time they come in is, do you have any bad habits such as reading? I ask them like this itself. Yeah. And so they all like, burst out laughing and saying, ma'am, yes, you're right. We have not read. We don't read. So reading is very important. So if you've not read, they don't have that speed to finish off passages quickly as required in that exam. So
Mm.
yes, so they have to do the reading and listening. They have to practice. So practice, I think, is the one thing that they have to do.
So, ma'am, like in listening, also, I think the speaker speaks in a Western accent. Is it online or is it one to one, the exam?
No, it is online in the sense that you can hear a recording and you will be given a questionnaire. So according to the the listen what you're hearing, the audio that you're hearing, you have to fill in the questionnaire. So most probably you will be given what the patient has said. It would be a dash. So the probably the doctor is asking a question and the patient has answered, and from what he's answered, you have to make out what he's answered and write it down. So as you hear,
Yeah.
as you listen, you have to keep writing. So you can't listen to it for a second time. The first time you listen, you have to write everything down. So that's a little bit challenging, I should say, especially for students who have never watched English movies or never, practiced on that type of material, it's difficult.
What is the difference between IELTS and OET? Ma'am? Like, I have written IELTS, but I have no idea about OET. How is it different?
Yeah. IELTS doesn't have many medical things. I mean, for example, you're doing reading. Maybe once in a blue moon, you might get a paragraph that's related to your medical field. But whereas
Hmm.
OET, it's completely medical. So everything is related in a medical way. Everything is based on medical terms, and everything is medical. So whether it's a listening, the reading, the writing, and the speaking. The listening is almost the same, but I would say OET is a little more tougher because you have all medical terms. So you must be really good at medical terms. Even the reading, I would say, is much more difficult because you have passages that are really long. Towards the last, you have really long passages. Part C has huge passages, and after that big passage, you have questions. You have to understand what you're reading quickly, and you have to finish it off. For writing, you have a letter. It's much more simple compared to IELTS because you don't have two tasks. You have just one task. But the letter that you get just the letter. I mean the outline, the case note as such, and that case note has to be transferred into a letter. So you have to know the letter format. You have to know the criteria. Only then can you write that letter in a way that earns you your score. Similarly, for speaking, you have a role play. Two role plays, in fact, for the exam.
So it's not like general topics, it's all about medical things. So everyone has the same standardized test, or it is different for doctors and nurses or dentists, like based on your profession, it is different or it is standardized?
No, it's actually different in the sense that the listening and the reading is the same for all medical professionals. It's just the writing and the speaking that's going to be different because the writing for a doctor it would be to another doctor. Similarly, for a
Hmm.
doctor, the role play is going to be between a doctor and a patient, unlike for a nurse, where it's going to be between a nurse and a patient. So that's the only difference. The listening and the reading is the same for all the professions.
In how many countries do they accept this OET?
It's accepted in basically like in New Zealand, Australia, Ireland, um, of course UK, and to an extent it's accepted in US also.
What about Canada?
Canada, they're starting on with OET. I think they are accepting in certain places because OET is basically for professionals. It's not for academic purposes. So we don't have many nurses who go there for working in Canada. So I think they're just starting on acceptance of OET.
I think for in Canada, you cannot directly jump into the workforce. You have to
Yes.
again restudy your thing courses and
Yeah.
all. That's why maybe it is not popular. I had someone like they flunked IELTS, but they could pass OET.
Mm.
It's when they two three attempts like after giving two attempts of IELTS, they said no, let me try OET, and they did OET and they get passed. So I think in IELTS, writing is a bit difficult. Like for doctors,
Yes.
it is about general topics and
Yeah.
all. But for
Yeah.
it, like writing case notes and that, it is a bit easier compared to IELTS, like for
Exactly.
only writing
Exactly.
ones.
Yeah.
So how can someone sound more natural and confident in speaking?
The speaking module, you mean?
Yes.
Yeah. Confident in the sense if you are good with your English, if you think, okay, you can manage your language, you become confident and you start speaking naturally. This is what we, in fact, tell students because most of them, what they do is they by heart certain sentences or phrases. So once they by heart these phrases and they try to imitate that, it sounds very unnatural, And what happens is the interlocutor might understand that you've by hearted certain sentences. He or she might, go out of it, ask you a different question, and then you get confused. Okay, this is not what I was intending to say. So, you might fumble a bit. So it's better to, practice a lot. Once you practice, you get that fluency. It comes.
Like in different scenarios, what you are going to say. I
Yeah,
think by hearting is the biggest mistake to do in speaking. Like
exactly,
even for
exactly.
IELTS, is I think by heart, like
Yeah,
keep be ready for speaking everything. Do not by heart anything.
Yeah.
And in the movie also it shows, ma'am, in Shah Rukh Khan's movie Donkey, they by heart same thing and they say same thing in the IELTS test. They showed IELTS. Did you watch that movie, ma'am, Donkey?
Yeah,
Shah Rukh
this,
Khan's movie.
yeah, sorry, I didn't get that. Shah Rukh Khan's, the one, they go abroad, is it?
Yes, Donkey, Donkey.
Yeah, 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 I remember. Yes, yes, yes. Yes,
Yeah.
by hearting is something that you should never do,
A
because
very funny sequence where they by heart something and everybody says the same thing at the examiners day.
this is what, you can actually understand, um, people saying the same thing, same sentence over and over again. So the person who sits there, the examiner, I'm sure the person will understand this is something by hearted. So they ask you something out of the box and you're unable to answer, especially in IELTS. That's a big problem.
Coming from India, English can be a barrier to our dreams.
Yeah.
For some segments, like they may be very good in their clinical skills and all, but English is not our first language, so it's expected that some people may fumble while speaking and all.
Yeah.
So many candidates have that fear and self doubt, and many will have attempted one or twice and they did not pass. So, what do you see most commonly, and how do you help them rebuild confidence and attempt the exam again?
Well, I've seen this at students, they might be really good at their subjects, but when it comes to communication, that's when they falter. And I think communication skill is the one that you must have, because when you go out into the world, you need to communicate with people. You can't be thinking that, okay, I'm just going to deal with machines. I'm not going to talk to anyone. You can't do that. Especially if you are from the medical profession, you have to communicate with people and you have to be a good communicator. So the first thing is, just free yourself from all inhibitions. As I walk into my classes, I say, see, you've come here for a purpose. Your language is not good. Do you feel that your language is not good? You want to learn. So don't feel that anyone is judging you. We're not here to judge you. None of us are here to judge you. We are all on the same, on the same boat. All of you are on the same boat. So it depends upon how you want to improve. So if you're going to be looking at people around you and feel shy and not talk, you're the one losing out on. So I tell them that, don't have that inhibition. Keep talking. You might make mistakes. Maybe you might hear all of us laughing sometimes. Even the person who told it might end up laughing when you translate it to them. So then they say, "Oh, ma'am, what a stupid mistake! How could we have made that?" They ask me, "Oh my God, did I really say that, ma'am?" I said, "Yeah, that's what you said." So they say, "Oh, so funny! And how did you not laugh there?" So I said, "See, this is what sometimes you say you make mistakes. We tend to make mistakes. We are all human beings." So I said, don't worry about that. Um, just keep talking, and once they're given that kind of encouragement, then they start talking and they get better. And as they get better, the thing is, we have mock exams every weekend. So whether it was for IELTS or PT or OET, we do mock exams every weekend. So every week they get to assess themselves also. So means, after the exams we give them their scores. So the coming Monday or Tuesday they get their scores. They realize, okay, I need to work on this, or this is where I'm not as good. So that helps them a lot. So as the weeks go by, they realize that they're getting better. Once they realize that they are on the right track, that itself is confidence. So that kind of helps them. They say, once they have completed and they're given a felicitation, once they get their scores, they come back for a felicitation. They always say, "Ma'am, the first week was really hell." And it's the same when you reach the exam batch. So we have a 2 weeks of exam preparation. When it's for OET, you have 2 weeks of exam preparation, which means in the exam preparation, you do 2 modules of each. uh, that's immense pressure. So they say that pressure is really good, because just before the exam, you practice so much that on the exam day, they literally are fearless. They just go there. They say, we have done everything. That's it. And there's nothing else to
Mhm.
learn, and we have gone through the toughest of materials. So and they come back and say, "Ma'am, that 2 weeks is what kind of finally got us there." So this is what students, those who practice, those who persevere, they're sure to get through.
Can you share a story of someone like who almost gave up on OET but eventually cleared it?
Yeah, I remember this girl. I wouldn't say girl, actually. She's married, and she has three children. So she was working in Saudi. And she said, "Well, I came back because I wanted to go to Ireland." And she came back, and she spent almost 6 months at different institutes. And every time she attempted her exam, she would lose in one of the modules she would lose. So the next time she would lose in something else. So first time it was listening, the second time it was reading. And when by the time she reached us, she was like, she said, "Ma'am, this is the last time. I'm done with giving exams, because this exam is also pretty expensive, because IELTS is probably 14,000. This is around 35 to 36,000 for an exam. So, so she was telling me, "Ma'am, I think I need to shift to IELTS." This is one mistake that most of the students do. When one type doesn't suit them, then they shift to another, which means they have to start the other from scratch. So that's difficult. So I told her, try this time. And then I realized that it's not that she was bad, or she was not able to do something. In fact, her writing was excellent, and I kept telling her and reiterating the fact that you're really good. That gave her confidence. And then she said, "Ma'am, but then why am I losing?" I said, "This is your confidence that just gives away for your exam. When you reach for the exam, you just feel that you're not good enough." She said, "I don't know what it is, but then I just want to clear it." We worked. She sat with us for almost 1.5 months, and then she said she was ready for an exam. After the exam, she was really sad, and she was worried that she wouldn't clear. She said it seemed very difficult, but 2 to 3 weeks later, when the results came, she had cleared. And she was just so happy because, finally her dream had come true, because she had stayed here for almost now 8 months, and there was a lot of pressure on her because her family was depending on her, and they were asking her to go back to Saudi or do something. And finally, she cleared. It was really a big
That
thing.
must have so you must have felt so proud of yourself also that you have been instrumental
Yeah,
in changing someone's life.
exactly. All the whole team, we were really happy. We said, "Well, finally she cleared." I mean, it's a testament to how much of effort goes behind it. She was when she came back for her felicitation, she was really, she was almost in tears, I should say. She was like, "Ma'am, this was my last attempt. I didn't know what I would have done if I hadn't got this."
Like you're not just teaching English, you are changing someone's life. you know,
Really happy to be.
make other dreams come true. And like moving abroad is not just about aspirations, like supporting your family back home and
Yes.
living a long held dream. So ma'am, apart from this OET, you mentioned that you have been teaching training people about public speaking
Yeah.
and other things. Like how do you train someone for public speaking?
Well, I have actually been training children. I've been taking classes at schools on public speaking, because I have
Okay.
students who want to uh, take part in competitions. Especially, they have their colors of their competitions. The CBSE competitions are there. Then they have their state competitions. So there are a lot of students who
Mm-hmm.
approach me, and they say, they want to see do public speaking. Or I have had students for who prepares for elocution, or say for anchoring competitions. So I
Mm-hmm.
basically, it's getting them to speak on any topic that are given to them. Sometimes there are topics that are difficult, but then according to their level, I try out different topics. I tell them to do a little bit of homework on topics that maybe they're not aware about. Sometimes there are students
Mm-hmm.
who like to see a lot of fiction movies. They know about all that. but say when it comes to art or when it comes to literature, they're not familiar with all those. So I say, why don't you go see some movies or maybe read some books? So I suggest reading newspapers and slowly we work on it. So sometimes it's just coming in front of people and speaking that gives them the jitters. Sometimes it's it's seeing a lot of people's faces and not knowing how to react to someone smiling at you. So I have had this boy who says that, ma'am, when I look at my friend and he smiles, then I forget what I have to say. So I say, then I give them tips and techniques on how to get over that fear, how to talk to people. So I help children out.
So, what age group do you teach this public? Do you
Well,
speak for public?
I have students from third standard to almost 12th standard because they start when they are really young. There are schools that uh, encourage students to start when they are in third standard and fourth standard so that they get better. As the years go by, they get really better and they can be sent for competitions on a regular basis. So every year they go for these competitions. There are a lot of competitions happening. So they take part in all that.
Ma'am, like, what are the tricks that you say? Like, if someone wants to get good at public speaking, so what do you suggest them to do? From where do you start?
Well, I tell them to just read something. It's a small exercise. I tell them to read something and then just explain it out to the people around you. What you have read. Maybe it's from a small article from the newspaper, a story that you just read the previous day. How would you explain it to a group? So usually we have a group of 10 to 12 students. So I make the student who has to who has to speak to stand right in the middle, in the center, and there are students like maybe around you. I make them sit in a circle and then just explain it out, talk to others, your friends. So if you are confident to speak to your friends all around you, you get confident speaking to bigger groups. So we start with smaller groups, maybe just first maybe a group of 4, then we increase it to a group of 10, and then I say, okay, why don't you try going for a competition? Probably when you go for a competition you can experience what it is, because if you just sit there, you wouldn't know how you could deal with it. What are the problems that you might encounter, because there are a lot of things that you can encounter on the stage. Maybe the mic just goes off, so what do you do then? So if you go the first time you go, you know what look for next time you go. So they get better. And I keep telling that winning is not the last word. Just go participate. So
Yes.
yeah, participation. That's what I want them to do.
So, like, you do voice training also. Like in some public speaking courses, they ask for voice training.
Not so far voice training as such, but I do tell them how to modulate themselves. Like sometimes when you want to explain something, or when you are exclaiming something, how does your voice go? So how do you tell? And I tell them to talk with energy, because some of them just becomes too obvious of the crowd in front. They become too obvious, they become too scared, and then their voice just drops. And the students who are sitting in front, they keep telling, ma'am, miss, we can't hear her, we can't hear her. So then the person standing there becomes even more nervous. So I say, see, talk loudly so that everybody can hear, like how each person wants to hear you. The person sitting at the end should also be able to hear you. So I keep telling them that louder, or sometimes I show it to them. So see, this is how when I talk, you all can hear me. So similarly, when you talk, everybody should be able to hear you. Only then we can ask you questions, or we can tell about it, we can talk about it.
I think, ma'am, this voice problem I also have. Like, I also speak very low in slow mode. So, even in online, creating content or something, we need to be so loud.
Yeah.
But I still have that hesitation. Not hesitation, it's naturally my voice is low. So sometimes even during the podcast, I go really low, and it happens many times. People ask like, "Sorry, repeat yourself. What are you saying?" So I think, how do you practice? Your voice. You have to become loud. How do you practice that? when you had
Well,
no one around you.
yeah, the thing is that I always tell these people, um, record your voice. Go when you sit and you're speaking, record your voice and then hear it yourself, the recorded one. When you hear, you can actually make out the mistakes yourself. So I
Hmm.
usually I make fun of them this way, that I say, see, you listen to it and you understand how bad we listen to it, how bad we must be feeling sometimes. Your voice, if there are a lot of fillers, and there are unnecessary sounds that come in, and there are long pauses. So once they hear it the first
Hmm.
time that they go do this recording, and I tell them to send it back to me. You record it and send it back to me and listen to it to yourself. And I listen to it and they listen, and then I tell them to give me a feedback on what they felt. When they listen to it themselves and they say, ma'am, we understood what you said, too many fillers, so that has to change. So this is how you practice. You listen to your own voice, you listen to your own recording. And I go a bit further and I tell them, try writing it down from what you heard. You just read from the newspaper, just read it, and then from your recording you should be able to write it down when you hear the recording. If you're not able to write it down, it means you're not clear. So you yourself are not able to write down what you have said, which means your clarity is not good enough. So all these exercises are really good. I mean, it helps you to get on that tone that people can hear. You have to be audible, and there should be clarity when you speak.
I think reading is also a big part of improving our clarity and voice.
Yes, yes,
Like when
definitely,
we
definitely.
read books, we get new ideas and we
Yes,
get, exposed to many other things. So, ma'am, you have also written a book of poetry. So, how did
yes.
the writing began with you?
I in between I used to write. I used to write articles for online portal known as the Women's Web. I used to write socially relevant articles. Yeah, and I had been writing regularly, and I was one of the top 50 writers for Women's Web. Uh, then slowly I started writing articles for the social media. I used to post articles on LinkedIn, Substack, and this was by chance that where I was doing an article, I had to write an article, and then they asked me, "Could you make it a little more shorter, something like in a verse?" So I said, "Okay, in a verse." So I thought a poem would be good. So I thought, okay, why not try my hand at poem? So it was maybe around 6, 7 years back. I wrote my first poem, and then slowly, whenever the occasion came, something came that really touched me. I realized I was good at writing down it in verse rather than putting it in an article. So I started writing poems, and I've just brought out published my book on Amazon. It's W O It's the poem inside, which is women or women. So we have named it women with a in between a dash in between.
WOMEN.
Yeah, exactly. Yeah, yes. So a selection of 16 poems. This is my first book. I'm working on other books as well.
I hope get other books released also. So, you
Yeah,
did a self publishing or with
yeah,
the tie up
yeah.
with the publishing
No,
house?
it's self-published on Amazon. Presently, I just got my paperback copy also published on Amazon just 2 days back. I got it published. So,
Congratulations.
thank you so much. Thank you so much.
So, I'm like, is writing a reflection of your personal journey through all these transitions?
Um, I think so. It is because those poems are definitely the feelings that I had over the years, whether be it about children, about women, and even about suicide. Uh, these are certain topics that have really touched me because these topics something very close to my heart. Too many suicides that I heard ended up as a poem finally. I had to write it. I had to pour it out onto a paper. So I have written on that. So I would definitely think, yeah, that would be a good word, a journey through all my years of womanhood, I think.
I used to write poems, ma'am, like back in my dentistry days, UG days. I used to write poems, but I never published them. But I had a fear of letting others know my inner thoughts.
I
So
think
actually, I destroyed all my poems. Now I regret that. But I don't know. Like I had a fear, like if someone else read these poems, what will they think? So I literally destroyed all my poems, and I feel so bad about it right now. But yeah, writing is kind of a reflection. It's like a mirror to our soul. You can say that
exactly, yes,
when you
yes,
start writing, that the inner thoughts just flow through you. Expression is also very important in that.
yes, it is.
So how important is expression, ma'am? How important is expression in building confidence? And
Uh,
even this is journaling is also a kind of self healing process.
yes, it is. I think, when I have thought about people who say that, let me go sit and write. That doesn't happen with me. It only happens when, I'm too disturbed. Yeah,
You feel aligned. Yeah.
you're overwhelmed with some emotion. It could be grief, it could be happiness, it could be something that's overwhelming. Whenever I'm overwhelmed, words just flow, and I if I put it into paper, then then that's there. Because all these have happened when I have been too, sometimes it's too much of anger, and that anger, once it's on paper, I find that there's a little bit of relief. I find that that relief is through that, bringing out the words, bringing out the emotions. So that's what I wanted to tell you also, that those were emotions. Actually, you gave a freedom to those emotions, and it could have well been really good. It could be shared, and people would realize, okay, we are not alone in this journey. There are people who feel like us, who have the same feelings. So yes.
Yeah, and it was my childhood habit that when I used to get angry, I used to write letters of paper, letters and letters. I used to write. Then I used to uh, kind of throw it away. Like I had all my frustrations open out. I need not yell at the other person or tell them something.
Yeah.
I used to write down and then I used to just tear it up. I think it was kind of a therapeutic for me that time also. Like at least I got it out of my system. So I think yeah, emotions play a very huge role in your writing and everything.
Yes, yes.
Ma'am, like today you are helping others achieve their dream. So what does success mean to you now compared to earlier?
Well, for me, success is contentment. It's being content at what you're doing. Because even if you earn a lot of money, or you buy a lot of gold, if it doesn't give you that contentment, that's not happiness. So this is basically why, when I shifted to teaching English, because I don't know, somehow dentistry was not giving me that contentment, and I said, let me do something that I feel happy with. And this is a reason that I shifted my profession itself. So for me, it's success is not just making a lot of money. Yes, money is important. I'm not saying it's not important, but then it's not just about money. It's about seeing a lot of smiling faces, being able to do something for others, and then at the end of the day, feeling happy about it.
That is a beautiful thought, ma'am. Like if we don't have contentment in life, then no money can. Having a lot of money can also make us feel
Yeah,
empty. I
exactly.
think we have to follow our passion, ma'am. So what did you have to unlearn when you rebuilt your career from scratch?
Well, I had to unlearn a lot of things. I had to, unlearn that. Firstly, when I started my journey with English, I had to unlearn the fact that not everybody knew English perfectly, because that was my biggest thing. And I was, initially, when I started teaching, especially IELTS, I realized that students didn't know meanings of even the small words, and didn't know the spellings and even the pronunciation. So I was under the assumption that everybody knew English and there was nothing difficult about it. But by and by, I realized that that was not the thing. So I had to unlearn that fact that everybody knew English. Secondly, I thought that everybody, we have this notion in mind that If like good looking, as in when others say you're good looking, you have that confidence to go on stage and speak. But that was not it.
Yeah.
That was a different thing. Confidence was something totally different. People would not be confident just because someone said, "Okay, you're good looking." That didn't give them confidence. You had to go up on stage and speak or perform. That needed a lot of confidence. So I was, learning a lot of new things. That you can't be judgmental. The moment you start being judgmental, people just freak out. Then they don't want to do anything. So yeah, I had to learn everything. So many things that I had to unlearn and then relearn the new ideologies, I should say. And in the process, I had to make new ones myself also.
I think going to their level to teach something is difficult. Like when we
Yeah.
have at a level, we assume everyone is at that level. But going back to their basics, to their foundations, building their foundations is
Yes,
what
exactly,
makes a good
exactly.
teacher. So yeah, brilliant ones, ma'am. How many people feel stuck in their careers yet they don't love? Like many, even dentists, doctors. I think like we have done medicine, we have to stick with it for life. So what do you think is really holding them back?
I think it's the stigma associated with changing to another profession. One is a stigma, and the second is, you don't know whether you will succeed or not. You take up another profession, you've already been studying for, say, if it's dentistry or medical, or you've already studied for 4 to 5 years. You've already put in a lot of hard work, and then after all this, you want to shift. I see a lot of engineers also, they're stuck. They say, we've done engineering thinking, we could probably work in this particular company, but then we're not happy where we are doing it, and we don't know what to do. A crucial stage in your life, uh, like you're in a dilemma. You want to get out of it. You want to go somewhere else, do something else, but you don't know what society is going to tell you. You don't know whether you will succeed. So I would say that it's not a big advice or anything. I would just say that whatever your mind says, follow it, because
Mm.
if you are dedicated and if you have a strong willpower, you will succeed in whatever you do. That's a sure thing. It's a guaranteed thing. So don't give up on your dreams, because you don't have another life to live. You have just this life, and don't realize at 60 that this was not what you wanted to do. Realize it at 30,
Mm.
or realize it at 25, at least at 40. So realize that, this is not where I'm supposed to be. This is not what I want to do. Do what you want to do. There might be a lot of people who give you negative comments, or, who try to say, what did you do so long? That's not what you have to do. There are a lot of people who, do succeed after 50. There are people who have gone and done their post graduation at 70. So don't bother about people. Go forward. Just do what you want, and do it with complete dedication. You're sure to succeed.
I read a story about an American woman who went back to medical school at 68 because she wanted to be a doctor. All her life she couldn't study medicine, so at 68, after retirement, she went back and studied her
That's
medicine.
what.
So I think that is an example we need to take for us. Like we have to, not think about the stigma or the judgment
Yeah.
that we get from others, and live for ourselves. Ma'am, for someone dreaming of working abroad but
Yeah.
feeling stuck, where should they start?
Well, you have to be clear on where you want to go. Firstly, decide on the country that you want to go. Decide what you want to do there. Then find the opportunities there. Because at present, opportunities are really less. Everywhere, opportunities are less. Whatever you want to do, you might not be able to reach there. You might have a lot of obstacles on the way. So see what is feasible for you. See what you want to do there, which country, whether you want to study. Make up your mind first. Decide on your path. See what is your final aim, and from there work backwards. So, say you're thinking about going to UK. What do you want to do in the UK? What do you want to see yourself doing there in the next 5 years? See how is the market for that particular. Is there a scope in doing that, or uh, are you going to do something, get educated there, come back and work here? So decide on that first, and then go about it, because presently there is, as we all know, everything has been affected. So there is a slight dullness everywhere. So think about it, and obviously you want to go anywhere, you have to give some exam. So decide what exam you have to give, what is your scope there, and how much you would have to spend. Money is a big crucial factor. So how much you have, how much you can spend, and obviously look at the returns. Don't just go blindly, because I know a lot of students who have gone to Canada, and they can't find jobs now. So they're thinking about returning, and they don't know how to break the news to their family, and they're stuck there. So don't reach that stage. Think about it. See what is the scope for you. Uh, ask people about the scope, and then think about going.
I think with internet and all, we can actually contact people and
Yeah,
see
yeah.
how your profession is there. And
Mm.
it's basically, I think, first you need to be committed to your goal, because
Okay.
going to any country is not easy. It is an achievement in itself, like leaving your all the roots behind and going to other country and setting yourself up. So I think the why behind your goal and
Yeah,
how committed you are. Like, people return back in 2 years, 3 years. When you're going to another country, you have to have the mindset that I have to succeed here. If you get second doubts or something, and with internet you can actually see if you are able to do that or not, if you can achieve that
exactly.
goals or not. So I think commitment is a big thing before selecting a country also.
Exactly. And even how well you get adapted. Getting adapted to a country is also very important, because I've seen a lot of students who go there, and say it's a European country. It's different, they have a culture shock initially, but then
Mm.
gradually you need to melt into that culture, or you have to become part of that culture. Yeah. So that's not possible with everyone. Most
Mm.
of them are okay with it. Some of them, they still find it very difficult after 3 to 4 years of living there. They still say we're not getting used to the climate. Maybe yes, you might have difficulty with the climate, but you know your body well, so you know how to get accustomed to it. The food culture might be very different, so you have to learn to
Mm.
either you need to learn cooking. So cooking is a skill that I tell all my students, that before you go, be it a boy or a girl, you need to learn cooking. It's a survival skill. So learn it so that
Survival.
yeah, you can survive there.
I think weather, and you can research everything right from your home before you start the process.
Yeah, yeah,
You can research everything and you need to prepare mentally for that. Like, maybe the research and the reality is a bit different, but most of the time it is the same. Like, we have
yeah.
Instagram, we have everything coming on in the internet, news channels, follow the news.
Hmm.
That is the big thing. What mindset shift is most important for preparing for any kind of exam or for OET?
Yeah, mindset shift is that you should be able to um, accept when you make mistakes. That's one thing I keep telling my students, because I've had nurses who are just maybe just those have just completed their nursing, and I have had nurses who have been working for the past 25 to 30 years. So they're very senior nurses. So when they come in, they should be ready to accept the mistakes that they make and ready to change. You can't be telling, well, I'm a matron in my hospital, so I'm not ready to accept what you say, or I'm not ready to accept the change that you tell me. That's not possible. You have to learn to accept it. It's just like when you complete your 12th standard. There are students who come after 12th standard. I find the same kind of an attitude where they say that I was the senior most in my school. Now I've just completed. So I don't think I'll make mistakes. So that kind of a attitude is
Mm.
difficult. You have to learn from your mistakes, and you have to let go. Like I said, let go of your inhibitions. Don't stick on to like, what if the others hear me and they say, why she's still talking like that. See, these are things that in a learning process, it's a learning curve. your curve gets better only when you leave those inhibitions and you're ready to accept new ideas and new techniques.
We have to open to learn. Actually, leave like you should be like leave everything behind and focus on what's
Yeah.
being taught to you. Ma'am, if someone listening today feels stuck in a life that looks right on paper, but they don't feel it is right inside, what would you say to them?
It's not right inside.
Yeah, like they're not, on paper it is everything is good, you are successful on paper, but you are not content with that. What would you say to them?
See, like I said, um, contentment comes from inside. You have to find out what makes you happy. So it's not going to be the same for any two people. So what makes me happy might not make you happy. So find out what makes you happy. Are you happy with a job that pays you well, but maybe you're putting in a lot of effort? Are you happy with it? Fine, you can. I mean, continue with it. There are people who would, think about. There's this very important talk about having your me time. People who have are very much concerned about their me time, or they want to spend more time with their family. So they would like to do some job that gives them enough time with their family, enough time for their self improvement, and that makes them happy. And go ahead with that. So don't think that another person's happiness is the same for you. They might be happy with something else. There are people who would be happy with having a huge salary, maybe working the whole day. They don't feel tired. They are happy working that way, and let them continue with it. I mean, if
Hmm.
that's their happiness, there are no worries. You're happy with it. You're content with it. That's fair enough.
Thank you for this insightful session. I'm sure many people who are listening to this will have some clarity on what they want to do in life and how to approach these exams and especially OET. Thank you for your time and thank you for coming on our podcast.
Thank you so much, Dr. Saida, for having me on your channel. And I really hope I can make a difference because, like I said, I've taught numerous students, whether it be in IELTS, PT, or OET. I've taught numerous students, and I've been really fortunate to have changed lives, especially guided them to go abroad, and their whole families have, been happy about it, and they have also found a lot of benefit in doing so, because when a person goes, it's the entire family that benefits from it, and they have been benefited. So
Yes,
I hope this talk will inspire people, and
yes.
once again, thank you for having me.
Same here, ma'am. It's been a pleasure. Thank you so much.
Yeah, thank you.